My patient today was a 16-year-old female. She was well nourished, alert and oriented times 3. She responds well to verbal commands, speaks clear English. Her posture is straight and erect and composed steady gait with no assistive devices or no assistance needed. The client's skin was warm to touch. It was uniform in color. There was no blemishes present and no foul odor. Her skin turgor was good and the skin temperature was within normal limits. The hair and scalp looked nice. The scalp had no lesions or masses. The hair is thick and silky and clean. The body had distributed a variable amount of body hair along the body. There are no signs of infection or infestation within the hair or scalp. The client's nails are light tan in color, the shape of a convex curve. It is smooth and intact with the epidermis. The nails returned within 3 seconds of the capillary refill. The head of the client is rounded, smooth, and symmetrical. The face of the client appeared smooth and has uniform consistency with no presence of nodules, masses, or lesions. The eyebrows of the client are symmetrically aligned and showed equal movement when they are raised or lower. Their hair was evenly distributed throughout the eyebrows. The eyelashes had hair that was evenly distributed and curled slightly outward. The eyelids had no discharge noted, no discoloration, and they were symmetric. The pupils of the eyes are black and equal in size. The iris is flat and round with perla. Pupils constrict when looking at near object and dilate at far objects when doing the thing. The auricles of the ears are symmetrical and has the same color with facial skin. The auricles are aligned with outer canthus of the eye. When palpating for the texture, the auricles are mobile, firm, and they are not tender to touch. During the assessment of the hearing test, both ears were able to hear clearly. The nose appeared symmetric, straight, and uniform in color. There was no presence or discharge or flaring. When lightly palpated, there were no tenderness and there was no lesions or masses on the nose. When inspecting the mouth, the lips of the client are uniformly pink, moist, symmetric, and smooth in texture. The teeth and gums, there was no discoloration of the enamels on the teeth. The gums were pink in color. The buccal mucosa of the client appeared as uniformly pink, moist, and soft. The tongue of the client is centrally positioned. It is also pink in color and slightly rough. The smooth palate is light pink and smooth, while the hard palate is more irregular textured. The uvula of the client is positioned in the midline of the soft palate. When inspecting the neck muscles were equal in size. The client showed coordinated, smooth head movement with no discomfort. The lymph nodes of the client are not palpable. The trachea is placed midline within the neck. The thyroid gland is not visible on inspection, and the glands ascend during swallowing, but they are not visible. When inspecting the lungs and the chest wall is intact with no tenderness noted and no masses or lesions. There is a full and symmetric expansion within the chest. The client manifested quiet and effortless breathing. The spine is vertically aligned and straight. When auscultating the heart sounds, there were no visible pulsations on the aortic, pulmonic, Erb's point, tricuspid, and mitral areas. When inspecting the abdomen, there were no lesions, masses, or bruises noted. It was symmetrical and the skin was unblemished. When auscultating bowel sounds, they were clear to auscultation. There were noises noted in all 4 quadrants. No pain or tenderness noted when palpating. Range of motion was equal bilaterally. The patella reflexes present bilaterally. Able to balance during Romberg's test. The scoliosis screening was negative with spine aligned with no deviation. The cranial nerves, cranial nerve 7, which is the facial nerve, cranial nerve 5, trigeminal nerve, cranial nerve 1, accessory, cranial nerve 3, oculomotor, cranial nerve 4, trochlear, cranial nerve 6, abducens, cranial nerve 8, which was the acoustic, cranial nerve 1, olfactory, cranial nerve 9, glossopharyngeal, cranial nerve 10, vagus, and cranial nerve 12, hypoglossal, are all present during the assessment. And this concludes my report for my head to toe final assessment. Thank you.